So I had hip surgery about a month ago. Yeah. Almost 2 years ago now. I think it's been 2 years. Honestly, I can't exactly remember when it happened, but basically I injured myself during martial arts. I was warming up and warming up too quickly, warming up a little lazily, and I threw a lazy kick, and it happened to be a round kick. This is my assumption based on what I've been told by the doctor. What it looks like to him happened to my hip. This is just my best guess based on what I experienced when I was actually practicing. Because there's one specific incident where I remember throwing a kick and feeling like, ooh, that felt weird in my hip, and then just like completely throwing it away, not even thinking about it again. I threw a round kick and didn't turn my back foot enough, so my body wasn't, like my hips weren't in the correct alignment to complete that kick safely. So let me tell you what exactly happened. I tore my hip labrum and I had to have it stitched together. I now have 3 nice little scars on my right thigh. The hip labrum is the cartilage inside your ball and socket joint. The head of the femur goes in and is rubbing against that cartilage. I tore that cartilage, so there was some bone rubbing against bone, which is never good. I did physical therapy before resorting to surgery, but it wasn't getting any better. It was honestly getting worse. It was causing me pain just doing everyday activities, like if I was standing for too long or if I was laying down for too long, like it would wake me up out of sleep. Just laying flat, like no muss, no fuss, but because of the positioning of the tear, being at full extension, whether standing or laying down, was very not fun for it, very painful. So walking is painful. I had really limited range of motion. I could only bring my leg back so far. I could only lift it up so far. I could only bring it out so far. And those are honestly things that I'm still dealing with. I'm just now at a month from surgery, so it's not completely healed, obviously. I'm struggling with like feeling, I'm an athlete and I've been an athlete my whole life. So not being able to do things, just like normal things, like running right now is no go. Can't do that. The doctor said he doesn't recommend that I ever go back to martial arts. I cried when I was first told that. I am prayerful that through physical therapy and just taking better care of my body in general, that I will get back to a place where I can do that, because I'm not just a practicing martial artist, I'm a stunt fighter. So that kind of works into my career, but I'm still dealing with some pain as I'm in recovery. It's a little nerve-wracking for me, like doing things. I'm in daily physical therapy, at home physical therapy right now. I go see a doctor later this week to determine whether or not I need to continue in-home physical therapy or if I can do outpatient physical therapy. I'm stretching the muscles in and around my hip and kind of rebuilding the strength back into my leg, because it was gone. Like after surgery, I could barely lift, like I had to physically help lift my leg to get it anywhere. Like laying down, getting in bed, you sit and you just kind of lift your legs to get them up above from the ground to the bed. I couldn't even do that unassisted. Like I had to lift my leg with my arm to get it to go. It was bad. I'm on the mend. Things are looking better than they were before. I don't feel pain when I press on the spot where the tear was, which I did before. So I'm like, it's healing. What the surgery did what it was supposed to do. I just have to be patient with recovery. It's really hard. I'm very grateful to the doctor who went in. It sounded like surgery went well. I was obviously out and I didn't get to speak to the doctor after I came out of surgery. From what I've been told, I was still out of it when he came to talk to my dad, but it sounds like everything went well. The surgery, went as well as it could have. I'm gonna, like I said, my first follow-up post-op appointment is later this week. So I'll see how recovery's been going, but so far physical therapy has been pretty good. Like I'm now to the point where I can lift my leg. I don't have to assist it anymore, which is nice. Got back most of my range of motion forward and out to the side. I still have a little bit of discomfort when I raise my knee past 90 degrees with my hip. Still working on, stretching that out, getting that back to where it should be. But the biggest area that I feel is still lacking in strength and in stretch and in recovery is my range of motion back, which is kind of important, not even just like for martial arts purposes, but just walking. Like walking is difficult when you can't. I have a pretty long stride. I have long legs, so I have a pretty long stride, and I can't take the full stride right now without potentially re-injuring it. And I don't know the threshold of what's re-injuring versus it's just pain because it's stretching and uncomfortable. So I have to be mindful. What the physical therapist has been telling me is everything is guided by pain. So if you feel pain, stop, because you could potentially be doing harm to the surgery. So it's been a really interesting time for me in learning patience and learning to give myself grace, and a wake-up call in terms of taking care of my physical health. Like I said, I'm an athlete, so I've been pretty healthy my entire life, but I don't do the greatest about like eating in general, not just like, oh, I eat junk food. For the most part, I don't, but I don't eat period, which is like not a great thing. So I have to like make sure that I'm, providing my body with the nutrients that it needs to stay healthy and to be able to take wear and tear, because it's gonna, things are gonna happen. Accidents are gonna happen. This wasn't even technically an accident, but accidents are gonna happen, and I have to prepare my body as best I possibly can to handle that. Anyway, I'm on the mend. Things are looking up. It kind of put my whole world on stop for a good couple of weeks. I'm just now getting back to like being out and about without crutches, and I'm just now getting back to like starting to do things normally. I can't drive yet. Okay, I had to do a quick little insert update because I haven't finished editing the video and I have gone to the doctor. So I am back to driving. Woo, it's very exciting. I am basically back to doing daily things. I still can't do any heavy weightlifting or running or jumping or anything that's going to put pressure on the joint. And within the next 2 or so months, I should be able to get back to those kinds of things. But my focus now is going to be outpatient therapy and focusing on strengthening that area and working on my flexibility and mobility, so that potentially I can get back to doing the things that I love. No one other than the surgeon has said anything about me not being able to go back to martial arts, but I know that's not something I want to rush into for fear of re-injuring it. Like there are things that are kind of basic now that I'm doing that I recognize myself unconsciously protecting from or favoring my hip, just like walking and things. Like the way that your hip works, like when you bring your leg up and stuff, like you're not supposed to tilt your hips to compensate to either way, forward or back, as you move your leg. But I've noticed myself doing that. So I have to like consciously remind myself to not do that. But also those are basic things that I'm still like, there's a mental block there, me being fearful that I'm going to re-injure the joint. So before I get back into any of those kinds of things, like it'll be a while before I get back to martial arts, but prayerfully with very intentional physical therapy and intentional strength training and flexibility training in that area, I will hopefully be able to get back to doing martial arts and all of the other normal things. I'm a runner. I'm a former track runner. So like running is just, that's just a basic thing that I'm like, I miss. I would love to be able to do again. So anyway, I just wanted to come in and update because JC is still in the editing room. So yeah, back to the original video. I just figured I'd come in here and say something. I also wanted to explain like why I had a couple of weeks where I didn't post anything, or anything new at least, because I just wasn't feeling it. Like I was physically not in a place to set up all my equipment and, you know, record and then edit. But I'm good now. I'm back. Expect more videos from me. Thank you for watching. If you would like to watch one of my most recent movie reviews, click this video right up here. And if you want to watch another video, I don't know, movie review, another video about me just blabbering, I don't know, click here. And I will hope to see you next time.